Over the past 10 years, I've worked with a lot of ADHD patients and have done thousands of different lab tests with my patients over the years. And so I know exactly which types of deficiencies when it comes to ADHD and what is the number one deficiency that I see time and time again because I've run these labs over and over again. And it was really hard to narrow down to just one because people with ADHD tend to deal with a lot of different deficiencies. And so I had to have a couple runner-ups. So I narrowed it down to 3 and I'll go in that order. The most common deficiency that I have seen when I run these tests over and over again is vitamin B6. Now, why vitamin B6? Because vitamin B6 is so critical for the whole neurotransmitter pathway. It's important for dopamine, serotonin, and GABA. They all require not only just vitamin B6, but the activated form of vitamin B6, which is P5P. And why that is so critical is because it's used as taking every step of the process, especially in the dopamine process of making dopamine. And if you are low in vitamin B6, you're going to have lack of focus, motivation, drive, and also energy. So it's also really required to having enough energy throughout the day, as well as cells that need energy production. Now, if you find that you're deficient in this, what I will recommend as far as the dosage to take, especially if you're deficient in this, is about 20 to 50 milligrams a day, but the activated form of vitamin B6. So that would be P5P. Now, the second most common deficiency I will see with ADHD, it's probably something that you wouldn't think it is, but it's something that I will see that is more of a primarily a problem with adults with ADHD. But what I have found is it has to do with your cortisol levels. Now, cortisol is so vital for really giving you energy throughout the day, but more importantly, also having consistent focus throughout the day. Because if your energy is low, it's hard as an adult with ADHD to have consistent focus and motivation throughout the day. Not only that, cortisol also does impact your stress levels as well as your sleep. And those things are so critical when it comes to your ADHD health. If you don't get good quality sleep, good energy, having good stress management, it's very hard to manage your ADHD. And so when I will test for this, I would say about 80% of the time I see people's cortisol levels tend to plummet, especially adults with ADHD. And so what I will recommend for this is a couple things. Is typically when we run this test and test your cortisol levels throughout the day, I will recommend either something like adrenal desiccated or bovine or some kind of adrenal support to take in the morning and midday, depending on where your cortisol levels are dipping. Now, if it's just in the morning, then we might just only take it in the morning. If it's just in the afternoon, you might just only take it in the afternoon. Sometimes it also will spike, but usually I will see the issue of a cortisol deficiency going on. Now, as far as the number one most common deficiency I see with ADHD, after running tests over the past 10 years, working with people with ADHD, this is definitely the number one that I will see. Now, it has to do with the whole dopamine pathway. Now, you think it might be dopamine. Dopamine is probably not as common as you probably think with people with ADHD, but it has to do with the dopamine pathway of the specific thing that you're deficient. So what I want to show here is this graph that I'll show right now of the whole dopamine pathway. Now, if you look at the dopamine pathway, you see that there's dopamine, and then what helps make dopamine is L-DOPA. And then from L-DOPA is you have tyrosine. A lot of people will supplement for tyrosine, but I will tell you, tyrosine is not even in the top 10, in my opinion, as far as deficiencies when it comes to people with ADHD. But it is also can be a factor. What it is, though, is the thing that helps make tyrosine, and that is phenylalanine. But it isn't specifically phenylalanine. It is even one step further. It is the excitatory neurotransmitter known as phenylethylamine, also known as PEA. This is the excitatory neurotransmitter that I will see about 80 to 90% of the time when I run these tests with my ADHD patients will be deficient. Now, why is it so critical? Because this is the whole beginning process of the dopamine pathway, of what helps make dopamine. And so if this is deficient, it's going to contribute to lack of focus, motivation, drive, those things, because this is deficient. You might find that dopamine might be fine, but PEA, phenylethylamine levels, will be low. So what I recommend, there's two things that I will recommend when I see these levels low. One is incorporating D-L-phenylalanine, so the amino acid, and this is an essential amino acid that you have to get through your diet, whereas tyrosine is non-essential, is because tyrosine can be made by phenylalanine. So the doses that I'll recommend is usually about 2,000 to even up to 4,000 milligrams a day if you are deficient in it. And I'll have you do that usually morning, at night is typically when I'll recommend it. Or the other thing you could do is you can actually directly take phenylethylamine, also known as PA, and do about 200 to 500 milligrams a day. Depending on your situation, this will be a case-by-case basis of how I will do it, because there's other lab tests that I'll usually want to look at before deciding between those two. Now, as great as supplements are, I will say this is really only a stepping stone, and you want to be transitioning to really using food as your medicine, lifestyle as your medicine. So if the number one deficiency is phenylethylamine, what needs to be fixed? Typically what I will see as a problem when someone has these levels that are low, it's because their protein intake is very low as well. Because guess what? Phenylalanine is an amino acid that a lot from our protein, same with tyrosine. And so therefore, we need to be making sure that we improve our protein intake. And so if you are not hitting the ideal protein amount intake every single day, this could be contributing to your symptoms and why you're also deficient in something like phenylethylamine. And so what you should be aiming for is, if your ideal body weight, let's say, for example, is 150 pounds, you should times that by 0.8, and that's how many grams of protein you should be consuming a day. Now, if you want to build muscle, the days that you exercise, you should times that by 1. And so if your ideal body weight is 150 pounds, then you should be eating and consuming about 150 grams of protein a day. Now, this is only one component to your ADHD symptoms. There's a lot of other things that could be contributing to causing your ADHD symptoms. So if you really want to learn how to eliminate your ADHD symptoms, then you should watch this video next, where I dive in deep talking about my 3-step system of how to eliminate your ADHD symptoms. So watch this video next.